are you involved in any long-term follow-up studies of patients that have been diagnosed with MS rather than, so this study we talked about was from CIS, following them on, but patients that have been already had an MS diagnosis and following them up long-term?
So, I mean, this cohort, the majority ended up with MS as well. So, yes, in that regard, but I continue to be involved in clinical and MRI studies. In terms of long-term follow-up, though, I suppose one has to clarify how long-term is long-term, because many of our studies run for 3 to 5 years or so, but actually these cohorts that are running for 10, 20, 30 years are relatively rare.
Yeah. And do you think that's something that we will start to see more of as...
I hope so, but there are challenges to running these very long-term studies. First of all, people need to be very clear why one wants this information, and I think there are good reasons to gather this information to understand truly what is going on in terms of the disease trajectory. But I think when we think about the way that studies are funded, they're often funded over a shorter period of time to answer very specific questions. For example, does a drug treatment work? And I think it's very interesting to think about the way that the duration of follow-up can actually inform our views about whether or not a therapy, for example, works, or another intervention is worthwhile, or whether a risk factor has a significant effect. Does that sort of answer your question?
Yeah, I think it does, but I agree that there's logistical problems as well as the funding side of things, of keeping in touch with the patients for that. I mean, with MS patients, they're obviously seen in clinic regularly, but there's always people move around.
Exactly. So, and it's not necessarily very consistent, and data isn't really gathered in a way that you can say, well, that's useful for these sort of longer term studies. Because I think in that regard, work through MS Base is very exciting, because they are gathering large scale data. I think they have about 50,000 people with MS on the database with clinical outcome.
So it's more likely that this sort of information will come from that rather than clinical trials, isn't it?
I suspect so, but actually the fine-grained data that we want to really say, well, what are the subtle factors that might be relevant? These large-scale cohort studies will gather the information that is routinely gathered, but I suppose it is always possible we may overlook something relevant that we haven't thought to ask about before, whereas I think the more detailed assessments may allow us to pick up things that are relevant that might not have been thought about in the first instance.
No, I agree. Thank you very much.
You're welcome.